Most people who carry HIV have absolutely no idea they have it, until the silent damage is already done. And by the end of this video, you'll understand the subtle warning signs doctors say people miss the most, along with the deeply rooted myths that are still costing lives today. For decades, 3 letters have carried a weight unlike almost any other diagnosis: HIV. But while the science has moved at lightning speed, public understanding is still stuck in the 1980s. This gap between what we think we know and what is actually true is where the real danger hides. It's a quiet crisis, and it might be closer to home than you think. Here is the cold truth. The virus doesn't care about your lifestyle, your background, or how healthy you feel today. Let's look at how it actually starts. The silent phase and what it actually feels like. In the very beginning, HIV doesn't look like a deadly virus. It looks like a common cold. Within 2 to 4 weeks of exposure, about 2/3 of people experience what doctors call acute retroviral syndrome. It is a fancy term for a flu-like illness. You might experience a mild, unexplained fever, a sore throat that won't quit, extreme fatigue, and swollen lymph nodes. Most people roll their eyes, take some aspirin, and go to bed. They assume they just caught whatever was circulating around the office. And then the symptoms vanish. This is where the virus gets incredibly deceptive. It enters a stage called clinical latency, or chronic HIV. During this phase, the virus is actively reproducing at very low levels, slowly wearing down your immune system. And this silent phase? It can last for 10 years or more without a single symptom. But don't let the silence fool you. Deep inside, the virus is slowly targeting your CD4 cells, the crucial helper T cells that act as your immune system's generals. In men, early symptoms are often completely ignored as physical exhaustion from work. In women, early signs are frequently misdiagnosed as persistent yeast infections or hormonal changes. By the time severe symptoms like rapid weight loss, chronic diarrhea, or extreme night sweats appear, the immune system is already severely compromised. The invisible threat and how it spreads. How does a silent virus travel so efficiently? It relies entirely on fluid exchange. HIV is transmitted through specific bodily fluids: blood, semen, preseminal fluid, vaginal fluids, rectal fluids, and breast milk. But the misconceptions about how it spreads are still shockingly common. Let's make this absolutely clear. You cannot contract HIV from saliva, sweat, tears, or casual contact. You cannot get it from sharing a glass, hugging, shaking hands, or sitting on a toilet seat. The virus is actually incredibly fragile outside the human body and dies almost instantly when exposed to the air. It requires direct, internal entry into the bloodstream, most commonly through unprotected sexual contact or sharing needles. But here is a critical fact that we will break down in just a moment. Thanks to modern medicine, the way the virus spreads has completely changed. Keep watching, because what we're about to share about transmission in 2026 will completely shatter what you were taught in school. A story of 2 paths. Let's look at a realistic scenario. Meet Marcus and Maya. They've been casually dating for a few months. They're responsible, successful, and both feel completely healthy. Because they trust each other, they decide to stop using protection. A month later, Marcus gets a scratchy throat and a mild fever. He shrugs it off as stress from his new promotion. The fever goes away in 3 days. He never thinks about it again. But Marcus was exposed to HIV over a year ago from a previous partner who didn't know they had it. Because Marcus felt fine, he assumed he was clean. Now, without realizing it, he has passed the virus to Maya. They aren't bad people. They aren't reckless. They are just ordinary people caught in the gap between a silent virus and a lack of testing. This is how the vast majority of new transmissions happen. People who feel perfectly healthy, passing it to partners who trust them. 4 deadly myths we must destroy. To stop this cycle, we have to dismantle the outdated myths that keep people from getting tested and treated. Myth 1. HIV is a death sentence. This was tragically true 40 years ago, but today, it couldn't be further from the truth. With modern antiretroviral therapy, or ART, HIV is a highly manageable chronic condition. People living with HIV who take their medication daily can live long, healthy, vibrant lives, matching the life expectancy of someone without the virus. Myth 2. You can tell if someone has HIV just by looking at them. You cannot see a virus. A person living with HIV can look incredibly fit, healthy, and radiant. The only way to know is through a modern blood test. Myth 3. If you have HIV, you will definitely pass it to your partner. This is perhaps the most revolutionary breakthrough in modern medicine. It is called undetectable equals untransmittable. When a person takes their daily HIV medication and achieves an undetectable viral load in their blood, they have effectively zero risk of transmitting the virus to their sexual partners. It is a scientific fact backed by the CDC and the World Health Organization. Myth 4. HIV only affects certain groups of people. The virus does not have a demographic preference. It does not care about your sexual orientation, your race, your gender, or your income. Anyone who is sexually active can be exposed. Believing this myth leads to a false sense of security, which is exactly why so many heterosexual men and women are diagnosed late. The cost of waiting. If HIV is so manageable, why are we still talking about it? Because of what happens when it goes untreated. Without medical intervention, the virus steadily destroys your T helper cells. When your CD4 count drops below 200 cells per microliter of blood, the diagnosis transitions to AIDS, acquired immunodeficiency syndrome. AIDS is not a separate virus. It is the advanced stage of an untreated HIV infection. At this stage, your immune system is too weak to fight off basic infections. Common colds can turn into severe pneumonia. Minor skin irritations can turn into aggressive cancers. The consequences of letting the virus run rampant are devastating, but they are entirely preventable. The tragedy today isn't that we can't treat HIV. It's that people wait too long to find out they have it. Taking control, prevention and protection. Protecting yourself is easier and more accessible than ever before. Beyond consistent condom use, there are highly effective medical shields available today. First, there is PrEP, or pre-exposure prophylaxis. This is a daily pill or a periodic injection for people who do not have HIV but are at risk. When taken consistently, PrEP reduces the risk of contracting HIV from sex by about 99%. Second, there is PEP, or post-exposure prophylaxis. If you believe you have been exposed to the virus, such as through a broken condom or a needle stick, you can take PEP. But timing is critical. It must be started within 72 hours of exposure to prevent the virus from taking hold in your body. The power of the test. If you take one thing away from this video, let it be this. HIV is no longer a shadow to run from. It is a manageable, preventable condition, but only if you know your status. Whether you are in a committed relationship or dating casually, regular testing is a normal, healthy part of being an adult. It is not something to be ashamed of. It is an act of self-care and respect for your partners. Your health matters more than embarrassment. Early detection changes everything. If this video helped clear up the confusion, please subscribe for more medically accurate, straightforward health breakdowns. Take care of yourself, get tested, and we'll see you in the next video.